Windsor Plywood in French Creek specializes in hard-to-source interior and exterior home finishing products, including flooring, doors, and moldings. Windsor Plywood French Creek carries high-quality, responsibly sourced products and are committed to providing outstanding value and personalized one-on-one service to all of our customers: homeowners, do-it-yourselfers, renovators, builders, designers, craftsmen, and contractors. Regardless of the type or size of your project, Windsor can help you bring your vision to life from start to finish. Let Windsor Plywood and French Creek help you with your renovation, new build, or building project. Call 752-3122.
You're listening to Nonpartisan Hacks Pulse Edition, our locally focused series where we zoom in on how big systems land right here on Vancouver Island. I'm Sean Wood, councillor with the City of Parksville and mayoral candidate.
And I'm Joel Grenz, also a Parksville City Councillor, but not a mayoral candidate. Today's recording location does matter. We are portable. We are in Nanaimo, and we are sitting in Donna Hais' office, which is literally across the street from Nanaimo Regional Hospital.
Our guest is Donna Hais. Many people in Nanaimo will know Donna as an active member of the community, but today she's here in her role with the Fair Care Alliance, a citizen-led advocacy group focused on healthcare across Vancouver Island.
And Donna, you may not know about this tradition, but guests do receive, in this case, 2 loaves of freshly baked bread by Sean, who baked the bread and brought it down from Parksville for you.
One's for Donna and one is for her illustrious staff member as well.
Brilliant. Thank you. I've had Sean's bread before, so I'm super pumped.
All right. Well, before we get going, we're just going to do our quick standard disclaimer, which is the views expressed here are our own and don't represent the official positions of the City of Parksville or any other body.
Donna, you're here representing Fair Care Alliance. Start by grounding us. What is it? How did it form? And why did healthcare access become the focus?
So about 2 years ago, in conversations with community at various tables that I sat at, it became very apparent that voice of the public and our community as a whole with respect to access to our healthcare was not happening. There was no conversation. There was no one talking about it. Basically, what happened, you have a sick family member or a friend, and you go to the hospital and you suffer through whatever's happening there. And really, there was no one speaking about what was happening there. So about 2 years ago, a group of community members, a group of doctors, a group of leaders from various communities who all sit on the Nanaimo healthcare ecosystem decided that the way to really have a conversation that was impactful with the province was to form a community advocacy group. And that's how Fair Care came to be. And initially, our only goal was to get the provincial government to announce that they were going to physically spend money on a new hospital tower build at NRGH. So our hospital tower was built in 1962 by my grandfather, and it's looking great. It's been there for over 60 years. But quite frankly, we are undersized. Our infrastructure does not meet current standards, and it needs to be replaced. And so we made it through the provincial election. We did lots of public information meetings, and really our main focus has been to inform the public about their access to healthcare. What does that really look like? What do the numbers really look like? And the numbers are quite frankly shocking. And we did a great job of that because our premier made a campaign promise, as did the opposition leader, made
That's
a
right.
campaign promise that they would, if elected, that they would build a new hospital tower on NRGH site in Nanaimo.
All right. Well, I'm looking across the street at, is there any construction over there right now?
Well, there is actually some construction over there for the cancer center, which is super exciting, but that was not the promise. That had already been announced that our cancer center was coming, and that was 10 years in the making. So, I don't want there to be confusion. Everybody thinking, hey, the cancer center is coming, which is excellent news. We need it. It's one of the tertiary centers that we don't have. In a tertiary hospital, which Nanaimo is a designated tertiary center, there are 19 tertiary programs. We have 2. Cancer will be our 3rd. So cancer is really important, but no, that is not a tower. And we were aware at the time that, a tower conversation through all of the things that have to happen politically, that have to happen through island health, that's really it could be open in 10 years. But we also found out very quickly that after the election, Fair Care couldn't go to sleep and go away. We were high-fiving like we're done. We've made it, right? We got the promise. It's going to happen now.
Yeah.
And then we all patiently waited for the budget and nothing.
Yeah. Tertiary care, for the listeners, tell us a little bit more about if you need some of those tertiary care services that are not available to who on the island, and where do those people go if they need those?
Yeah, so tertiary it's really important the community understands this conversation, because there are 3 levels of hospital. So there are community hospitals, and the Cowichan Hospital that's currently being constructed, that's a community hospital. We desperately need it. It's not redundant. West Coast General, which is having a whole bunch of closures right now, that's a community hospital. That is a disaster, what's happening there. That's very detrimental. Campbell River, Comox, community hospitals. And that's great. I break an arm, I need an appendix out, I'm going to my community hospital. NRGH is the community hospital around Nanaimo as well.
And there's urgent care in Parksville as well.
And urgent care in Parksville. These are all very integral pieces of a very complex system. But the next level of care is tertiary care. And tertiary care is, I have a heart attack, I have a stroke, I have kidney disease. Those community hospitals will refer all of their patients to a tertiary center. There are 3 tertiary centers on Vancouver Island: Royal Jubilee, Victoria General, and Nanaimo Regional General Hospital. Roughly, as I said earlier, 19 programs in a tertiary hospital. Nanaimo has 2 of them. So Nanaimo's tertiary catchment area is everything from the Malahat north.
Okay. What's that population? Do you know off the top of your head?
Well, I've heard numbers as high as 490,000 people, right? 430,000 people live south of the Malahat. They've got 2 hospitals, over 800 tertiary beds at their hospitals. We service nearly 500,000 people. We have 354 tertiary beds. The numbers are kind of scary.
Yeah, and that speaks to the name Fair Care Alliance. So maybe, I guess that's part of the conversation here, is what is fair and what is the, I guess, Canadian standard that would be expected in terms of care access?
Yeah, so our name really boils down, it's very straightforward: fair and equitable access to care, right? So quite frankly, I live Central Island. I pay the same taxes. I have a sister who lives in Victoria. We all pay the same taxes. We do not have fair and equitable same access to care, right? She's going to get tertiary care way faster than I am, because if I have a heart attack, there's no cath lab in Nanaimo. She has a heart attack, there's 2 cath labs in Victoria. And so, our name kind of says it all. That's what we've been fighting for, is to get noticed. We have been. And so I think, one thing that's pretty important to understand is this inequitable access to care is not a new thing in Central Vancouver Island, right? This wasn't caused by the current government. This is decades of governments from various parties looking past Central Vancouver Island and saying, hey, you guys can all just go get your care in Victoria. That's okay, right? You guys like driving to the Malahat or taking a helicopter. It is a beautiful drive. In the winter when the roads close, it's not so great.
A little more treacherous.
Yeah. And so there's kind of been this lack of understanding at the provincial level that there is a very fast growing population living north of the Malahat, and quite frankly, the oldest population in Canada.
Yeah. How does everything cost money, Donna? So how does funding, a huge project like filling out the other 17 systems that you need for tertiary care or patient tower or catheterization lab, how does funding work for that?
So the model currently for everywhere other than Vancouver and the Lower Mainland is that your regional district where you live funds 40% of infrastructure costs and 60% are funded by the province. The only reason that's different on the mainland is they have TransLink. So they have a transportation model that is like that versus their healthcare model. So we really rely, when you read your property tax statement and it says health, that's for 40% of infrastructure costs for these major projects.
That's right, the capital cost. So not running the thing, but getting the thing built to begin with.
That's right. We rely on groups like Island Health, or in this case for a cath lab, BC Cardiac Services with Island Health's direction. They fund the operating costs.
And has local government done their part here in the Nanaimo region?
Oh, hugely. I am so proud of the Regional District of Nanaimo and their hospital board. I'm sure if you've seen what's going on in the media lately, this last week we got the motion on the table through Mayor Mark Swain, who put together a two-part motion. Really important to understand the complexity of the two parts. But in essence, it is to put $50 million of reserves, of which the RHD will have $107 million of that this year, but to take $50 million of that in the 2026 to 2030 business plan and put $50 million aside with the term cath lab directly beside it. What's important about that is that we know the $50 million will cover 100% of the build. Now, the motion was twofold, and here's the other important piece. They also agreed in the second part of the motion to fund 100% of the cost. Why is that important? Because we have a municipal election in October. And if that budget runs over $50 million, we may be stuck with the new RHD. But under their motion, they've agreed to cover 100% of the cost when the build happens. The other thing is they've agreed to pay 100%, but only as part of the overall tertiary campus of care development, which will involve a new hospital tower at $1.7 billion is what I heard a year and a half ago. Realistically, it's going to be over $2 billion. We all know that with what happens with infrastructure spending. But this is, in essence, what's happening is our regional district is being creative. They are loaning the provincial government their 60% of a cath lab, and it will come out of the tower build at the end. And why is that important? It's important because we clearly at Fair Care have identified the next tertiary program we need is cardiac services. It will save the most lives. The number one killer of people in Canada is what? It's heart and stroke. Mm-hmm. And a cath lab is the next critical piece that will open up that critical path to care for our community and people who live in central North Vancouver Island.
We all often hear, Donna, of the province having a deficit right now. How did the local government come up with the $50 million?
So the $50 million comes specifically from a consultant's report that the Nanaimo Regional District Hospital Foundation had done out of their own pocket. So the District Hospital Foundation decided to fund a study by Make Consultants. Now, wondering who Make Consultants is? They're the guys who are doing all the hospital costing and projections for Surrey. So Surrey's getting a whole new hospital. They're getting a cath lab. These are the people, boots on the ground. They know what it costs. They know what size it needs to be based on your population and on your demographics, like oldest population in Canada. How many cases are we going to have of heart disease? These are the guys who know. They reviewed 4 possible locations for cath services, 2 within the hospital. One is sort of a temporary modular building, and one is a freestanding build. They told us what it would cost. They told us how many rooms it would have. They consulted with local doctors. They consulted with cardiac specialists, one from Boston who's running a cardiology program down there. This is a really informed report, so we know what it costs. And the regional district took that information, knowing what the cost would be, to form a solid plan. And
so the $50 million is from property taxes, is it? That the regional district has raised those from homeowners, I guess.
That's correct. Yeah, our community is actually investing in our community's health.
Sure.
That's exactly what's happening.
Mm-hmm. And how do we think the province will take the motion that was passed the other day? Or how do we hope, I guess, they'll take it?
Well, my hope is that they'll see it as being re-certified that the public is behind this, the community is behind this. Mm-hmm. And I think they, like Fair Care, should celebrate that local government is standing up and doing what it needs to do for its community.
Yeah, that's their job.
That's their job. Yeah. That is your job, guys, when you go out there, right?
Yeah, Sean's playing coy because he's on the hospital district board.
It's okay. It's not coy. It's more just, helping our listeners understand kind of the goings on of what's going on. And,
Yeah, and I think on that, it's also good to clarify sort of the hospital district board and the foundation.
Yes.
And these are both local entities that are sort of community focused and understanding the needs of the community very strongly and taking that to the provincial government, now stepping up and saying, we're going to cover the cost. To really show the province that this is really what we mean business on here in this community.
That's right. That you're committed to putting the people and community first is what you've shown, quite frankly. I had a friend say to me the other day when we were talking about the work that Fair Care is doing, they said, we need to make healthcare above the political cycle. It can't be sacrificed as part of the political cycle. To be quite frank, healthcare being part of politics is wrong.
Yeah.
Because it's about people.
Yeah.
And it's also consistently the number one issue when people are asked about what's important to them in elections and that sort of thing. Healthcare, whether it's federal, provincial, local, healthcare pops up as a key factor because, well, we all need healthcare.
We all need healthcare. And, you know, I think the thing that pleases me as the chair of Fair Care incredibly is one thing that we have been challenging, whether it's local government, the provincial government, and we're going to be doing some work at the federal government here pretty quick. We need to get outside of our boxes. Healthcare is broken. Mm-hmm. So if we keep addressing it the same way we've always addressed it, we're just putting Band-Aids on a system that is broken. We actually need to come up with the cure and how to do that. And so by thinking outside of the box, the RHD has been able to come forward with this plan that actually gives some legs to a plan that gets healthcare back to the people. Mm-hmm. And that's what needs to happen.
Mm-hmm. One of the reasons why I love supporting this motion on Tuesday was, we've raised the money and it's sitting in the bank, and I would much rather see it going to good use right away instead of it sitting in the bank, maybe making some interest for us where we don't know what the answer is coming from the province or when something can get started. And this really feels like, hey, okay, we've got the money. Let's start rolling on it.
Yeah, investing back in community for sure.
Yeah, one of the jobs of any elected body is to prioritize. There are always all these things we could be doing. This is setting a clear priority. This is what we feel we ought to be doing and should do next, and putting the money where the mouth is on that.
Yeah, it's exciting.
What are you hearing from residents around where things are headed with care in our region? And are there additional cracks that Fair Care Alliance is looking to kind of fill? Or what's next for Fair Care Alliance?
I'm excited about the plan moving forward because it's big. It's really big. Fair Care Alliance 2 weeks ago has hired federal lobbyists to work on our behalf in Ottawa to get the attention of our Prime Minister and our federal government to invest in healthcare in Nanaimo.
Wow.
Yeah.
Okay, that's significant.
That is significant. And here's why we think it has real legs and is a real story. And people who've heard me speak at events have heard me speak about this before. So geopolitically, historically, when have we ever had a prime minister whose family lives in Nanaimo? So the prime minister really knows where we are and has been here to visit family. That's never happened before. And it's probably never going to happen again. Mm-hmm. Although, I don't know, Sean, I just heard you're running for as a mayoral candidate. Yeah. Like maybe that's next.
I mean, we can get Leonard to run for prime minister.
Oh,
too.
There we go. I'll talk to Leonard about that. The other thing is our federal government made an announcement in the last few weeks about $5 billion towards hospitals. Quite frankly, you know, when I talk about numbers for hospitals, $2 billion for our tower, $50 million for a cath lab. You know, even in that conversation, we haven't talked about additional operating rooms and all the pieces we need. Mm-hmm. $5 billion is not a big number. Mm-hmm. But not only do we have all the statistics, fifth fastest growing center in Canada, oldest population in Canada, our infrastructure is over 60 years old. You know, we get into wait list times. I can get into what our case times look like and all of those details. So we have this perfect picture piece where, yep, our tower we have a case for the money. The other piece is we had an Indian hospital in Nanaimo. I'm embarrassed to think about. I feel emotional thinking about it, as everybody should. And that is a special situation or a special case where our federal government needs to pay attention to what's happening. Those lands recently transferred to Nanaimo First Nations, as they should have. Mm-hmm. But now what that means is there's a broader opportunity for conversation. So we've hired 2 lobby groups. We're going big. We understand that this is really the historical time for us to take a stand, and we're taking our case to Ottawa. And our first lobby group is working on Vancouver Island to work with us with the nations in the conversation around what opportunities of healing can be presented through a hospital rebuild and what that looks like. And that's a really complex conversation that we need to pay attention to. It would worry me if we rushed into building the tower and not have had taken a bit of time to talk about these First Nations conversations and their role in the healthcare conversation. So we're going to do that. The other piece is that we've hired a lobby group in Ottawa directly to work for us. I'll be in Ottawa middle of January. We just set those dates this morning. And we're going to get in and we're going to talk about how our hospital differentiates and our situation is differentiated from every other hospital in Canada, and why we have a more compelling case for the federal government to fund our hospital rebuild. Now, straight up, every conversation in Ottawa, I have no doubt that I do this for other organizations, is going to come back, you need matching funds.
Yeah.
Which means the province is going to have to come to the table and do some matching funds. To be quite frank, we're going to distinctly point at that our regional district hospital board has already taken a leadership role. And that's why this motion was so important last week, right? Because our local governments are already leading this conversation and stepping out of their box to do what's right for the people who live here. We're going to ask our federal government to do the same thing.
And $50 million is not a small number either. For
it's huge.
Local government, yeah.
It's huge. Yep. It's a huge amount of money.
Yep.
And it's a huge amount of money for the number of taxpayers who have paid in.
Yeah. What can people do to help out? What's the next move for someone who's like, wow, let's make this happen?
So we still have a petition. We ask you to go online and look up our Fair Care, all of our social media pieces, get our newsletter so you stay up to date. If you haven't signed our petition that's going before the province, we have something over 12,000 signatures. Realistically, we service nearly 500,000 people. That number needs to be a lot bigger. So please go online and sign our petition. We're hoping to present that to the province now that we have the motion that came from the RHD. We're hoping to have that before the province early in the new year. And we're going to ask the province then to also make sure they stand with us when we speak to the federal government.
And that's at weneedhealthcare.ca.
Correct.
Well, Donna, from my standpoint, I love working with you. You are an amazing advocate. You put you on the microphone and there's nothing that you can't do. You're a machine. And thank you very much for making the time for Joel and I on our podcast. I really appreciate it.
No, thank you for having me.
Yeah, very excited to have you in Ottawa fighting the good fight for us here on the island. That's pretty great news to hear.
It's not her first time there. I've seen her there. I've met her there.
Oh, yes, see me there.
Okay, all right.
Yeah, she's there. For sure. And Victoria.
Yeah, well, I think, we've got a very good advocate. We're very fortunate here in this community to have Fair Care Alliance stepping up to the plate and working together collaboratively with the hospital district and the foundation. And I think ultimately the federal and provincial governments as well, hopefully to get this thing, get the things in the ground. What do you do? The shovel?
The shovel. Yeah, the shovel's in the ground.
And our podcast is called Nonpartisan Hacks, and Fair Care, of course, is nonpartisan, and that's sometimes the best way to advocate with the parties that are in power and with opposition. And I feel like it just gets more done when you can say that you're nonpartisan, for sure.
Correct. Yeah.
All right. Well, that's it for this Pulse edition of Nonpartisan Hacks. You can find more locally focused episodes through the Pulse Community Network and our main feed at nonpartisanhacks.com. I'd like to once again thank Donna Hais from Fair Care Alliance for coming on the show today and talk to us about the important issue of healthcare.
Donna, you're amazing. For listeners who want to learn more about Fair Care Alliance and what they're doing, you can find them at weneedhealthcare.ca. Please sign the petition. Until next time, take care of yourself and your community.
Oh, we're saying it together.
That's all right. That works.
Windsor Plywood in French Creek specializes in hard-to-source interior and exterior home finishing products, including flooring, doors, and moldings. Windsor Plywood French Creek carries high-quality, responsibly sourced products and are committed to providing outstanding value and personalized one-on-one service to all of our customers: homeowners, do-it-yourselfers, renovators, builders, designers, craftsmen, and contractors. Regardless of the type or size of your project, Windsor can help you bring your vision to life from start to finish. Let Windsor Plywood in French Creek help you with your renovation, new build, or building project. Call 752-3122.